Hi, and welcome to Kaleidos Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. My guest today is Dr. Mark Falvo, the Director of Colorectal Surgery at Millard Fillmore Suburban Hospital. Today, we'll be discussing a new standard of care called the Enhanced Recovery After Surgery. This process changes the traditional patient preparation for surgery and speeds up the healing and recovery process. I'm Mike Hughes, and this is Medically Speaking. Dr. Falvo, thanks for joining us today. Tell us a little bit about colorectal surgery and what that is in comparison to other types of surgeries.
Yeah, so colorectal surgery, it's a field in surgery that specializes in diseases of the colon and rectum. Colorectal surgeons can deal with ailments that are as simple as hemorrhoids to as complex as colon and rectal cancers.
So tell us a little bit about the field of colorectal surgery. What are you and your partners doing these days?
So we practice predominantly in Kaleida Health, do a lot of work at Millard Suburban Hospital. The types of surgeries that we'd be involved with the program we're talking about today would be things for colon and rectal cancer, diverticulitis, essentially colon surgeries.
Sure. And some of the newer things that you guys are involved with is the Enhanced Recovery After Surgery, or ERAS. Can you talk a little bit more about that?
Yeah, so Enhanced Recovery After Surgery, it's a program that we've adopted here to help patients before surgery, during surgery, and after surgery with recovery and healing.
Okay. What's different with that type of process or that type of philosophy when you're operating versus what you may have been doing, say, 5 years ago here at Suburban Hospital?
So it's looking at the whole process of surgery versus just when the patient comes in and has their surgery. So in the past, when patients would have colon or rectal surgeries, they would very commonly just come into the hospital. Some of the information might be vague to them. There wasn't a team approach with these patients. Now, educational materials are given out before surgery. They go to classes before surgery to kind of tell them about the process. In the hospital, they're managed differently also. There's a team approach here in the hospital with looking at nutrition, anesthesias on board with some of the programs that we're doing, and then the nursing staff on the floors helps us kind of really tie the whole program together.
We'll get back to the team approach in a second, but I want to go back to the that new type of process, that enhanced recovery. That's a national best practice. I think people may have a little bit misunderstanding that, you know, Buffalo is a big place for healthcare. It's a growing part of the economy, and there are a lot of national best practices that are happening in all types of surgery. So talk a little bit about more about your field and colorectal surgery and why you guys are implementing national best practices, or how you guys may be leading either the region or the Northeast or nationally in some of the things that you're doing.
Yeah, it's a great question. So when we go to the national conferences for continuing medical education, this has been a pretty hot topic for the past few years. There's outcomes that were shown that patients would heal faster, recover faster, and have a better experience with their surgery. And it's something that we wanted to have here in Buffalo. You know, the Kaleida Health teamed up with us and nursing staff, and we're moving forward with trying to make that happen for patients here.
That's great to hear. So you mentioned the team approach earlier. Maybe a few years back, patients would deal individually with the surgeon's office, and then maybe admissions, and then maybe nutrition. What has changed, and why is that team approach so important to the outcome of the patient's surgery?
Sure. So now what happens when the patient has that first interaction with you in the office and they're scheduled for a major colon or rectal surgery or other colon surgery, the process starts there. They're given some initial materials, a pamphlet that's been made by the hospital and by Kaleida to kind of guide them through the process from that office visit all the way through their surgery. So pre-op, intra-op, and their hospital stay, as well as their discharge home. There's materials that discuss nutrition, healthy habits beforehand, you know, avoiding nicotine, avoiding alcohol, starting in actually maybe a mild exercise program. Those are things that are done before surgery. And then during the surgery in the hospital stay, we have certain processes here that we've determined help the patient with recovery also. Monitoring glucose levels very, very closely, nutritional changes that have happened here while they're in the hospital. And then post-op also things that will help them leave the hospital faster and recover easier. Aggressive ambulation, meaning getting them up and walking early, getting them appropriate nutrition after surgery, making sure that they understand the healing process and they're not doing things they're not supposed to do when they leave, or they're doing things that they should be doing when they leave.
Sure. So is that considered the gold standard of care these days, where you have nearly everybody around the patient, touching the patient, pre-surgery, during surgery, post-surgery? Is that the new standard of care?
It's probably not everywhere, but I think it needs to be, and it's definitely our standard of care. We wanted to raise the bar here for our patients and provide what we saw appear to be best practices elsewhere.
I have to imagine that that type of team approach is probably as much important from the healing process as it is psychological or peace of mind for the patient. Are patients having better outcomes as well because they feel more comfortable, they feel more confident in the team approach?
Yeah, I think when patients are more informed, they feel better about the process in general. So the education materials and the classes that are provided for the patients in learning, it definitely gives them confidence coming into the hospital. It helps them understand better what's happening to them when they're here and they have their surgery, and what to expect when they leave the hospital. Problems arise when patients' expectations don't meet what we can provide for them. So when they have everything up front and they know what we can provide, it's always a better outcome.
Because it's not your traditional orthopedic surgery where you might have, arthroscopic surgery on your knee or something like that. Colorectal surgery sometimes may have a stigma to it, or there may be a fear because of, parts of the body that it's involving. So what do you tell patients in terms of those types of concerns or issues that they have and the need to go through with that to make sure that they do have relief on the other side?
I think we just try to tell them that it's, although it might be something that's dramatic for them, for us, because we're trained, it's something that's fairly routine. And that's not to make light of their situation, but with the education and proper discussion in the office and making them feel comfortable here at the hospital, I think that goes a long way with getting them through that process and easing any fears they might have.
And so when you say you got your team or your partners in surgery do that a lot, do these types of procedures a lot, talk more about that. So, what are you doing at Millard Suburban Hospital? How many procedures are you guys doing as a group? And why is that important in terms of quality equaling quantity? Sure. In that sense?
I think it's important for patients to understand that if they come to see a physician, that physician is skilled in that process. And we offer that to our patients because we do see, unfortunately, a lot of colon cancers, a lot of rectal cancers, a lot of diverticulitis. We're comfortable with doing those procedures. We're comfortable with the newest procedures that are out there for that because we've been trained in it. So it's a win-win for the patient, the hospital, and the community.
Sure. So you've been at Millard Suburban Hospital for some time now. You've seen the growth. You've seen the evolution of the hospital. Talk a little bit more about the hospital growing and then what you in particular have seen in terms of the changes on the surgery side, the growth of robotics and things like that.
Yeah, so I've been here at Suburban since I started. I was a resident. I've seen the hospital grow from a busy community hospital to a very busy community hospital. Growth of services, growth of programs here. We started off with one robot for surgery several years ago. We've now gone to 3 and hopefully more. I think the hospital growing with the community and growing with technology is imperative for patient outcomes in the future. I think if hospitals or physicians stay stagnant in their training, or if they're not meeting the needs of the community, that's going to lead to bad or worse outcomes. So Suburban and Kaleida has done a great job with keeping up with the demands in the community as well as the technological demands of the patients and the surgeons.
Sure. So you're taking care of more and more patients each year. For those who may be watching this or have questions or may have been referred by their primary care doc or may be referred by their primary care doc to a colorectal surgeon, what advice do you have for them and how can they get involved or get in touch with someone from your office?
I think patients need to be educated regarding their disease and always seek out a specialist in whatever their disease process is, whether that's colorectal or a heart ailment. you want to go to somebody that's adept and trained in what they're doing. And I think seeking out those people would lead to the best outcomes for patients.
Sure. Dr. Falvo, thanks for joining us today.
Thank you.
Thanks very much.
You're welcome.
Thanks for joining us today. I'm your host, Mike Hughes. We'll see you next time on Medically Speaking.